Hi everyone, Madam Moderator, thank you for the kind introduction, esteemed panelists and observers from wherever you are in the world. My name is Haris Zainul, as mentioned earlier, and I'll be presenting a bit about misinformation in Malaysia. So what we've seen in 2020 and what we can expect for 2021. All right, so I'm going to go through three main points, as mentioned earlier. So I'm going to give a year in review when it comes to misinformation in the Malaysian context and going as granular as possible into the types of false claims that we've seen. And then before moving to the what we've been picking up in the fourth quarter of this year and what we predict to be a major issue coming into 2021, which is anti-vaccination propaganda. And I think this is because as we move closer towards the discovery of a vaccine, this is going to be a pressing issue, and it is worth to be looking into this at the earlier stages to get ahead of the curve. And lastly, some lessons learned in 2020 and how we can incorporate that into 2021. Okay, the first thing. Right, so as an introduction, the research I conducted earlier this year was meant to solve the information deficit that we had. So we knew that with the onset of the COVID-19 pandemic, it led to the infodemic as well. But what we did not know was the more granular details of COVID-19 false information, things like what were the exact types of false claims being made that's pertaining to COVID-19, what were the formats that these false claims were appearing on, what were the mediums it was being circulated on, what was the apparent motivation behind it, and did it have an element of imposter content, which is problematic because it gives the false information a semblance of legitimacy. And why knowing this is important is because different types of false information causes different types of harm, and this in turn requires and justifies different types of policy responses. Those who have read my work will know that I'm not a big fan of heavy-handed responses to creators of false information, so I'm not on the side of prosecuting people for what they probably wouldn't have known. So to fill that information gap, what we did was to conduct a study using the fact checks published on sebenarnya.my, and sebenarnya is translated from Malay to English as but actually, and it's a government fact-checking platform where the government's efforts of fact-checking is published there. So what we had done was to quote about 353 individual debunks made between January to 15 June 2020, and that was a study period. And we coded it for the 5 categories listed there, and I'll go through in a bit. So okay, when it comes to the medium, right, so it generally refers to where did the false information circulate on which platform. And we know this information because on sebenarnya.my, when they fact check and debunk something, they include a screenshot of the false claim. So from there, we can piece together the information. The highest medium was WhatsApp, followed by Facebook. And I think this was quite interesting because WhatsApp, as we know, is an encrypted communication platform, meaning that the government cannot have oversight into private communication messages, right? So I think this indicates that the public tip-off channels are working as intended. So the public, when they encounter a piece of potentially false information, they are reporting it to the authorities. When it comes to the format of false claims, the large majorities, they appeared in text format, so just words, while by, if I'm not mistaken, about 18% appears as text and photo. Sometimes these photos appear, they have appeared elsewhere before and they're being repurposed for this new type of false information. And there's also instances where videos that happen elsewhere were claimed to have happened in Malaysia. There were no evidence of deep fakes in the samples that we looked at, although there were some examples of cheap fakes where less high-tech edits were made. Okay, when it comes to types of false claims, this generally refers to the content of the false claim itself. And looking at the first chart on the left, it's clear that the highest, by a clear majority, is the authority action type of false claim. So in this type of claims, basically someone is alleging that the government is doing or not doing something. And the second type of largest category is community spread, where they falsely claim that there's a COVID-19 positive case in a specific locality. Interesting enough is that in the data set that we looked at, there were very few conspiracy theories and also anti-vaccination types of false information, information about how the virus transmits. So those were quite rare in the samples that we looked at. And I think this differentiates the Malaysian experience quite a bit from what's happening elsewhere, such as the US, for example. If we were to plot the types of false claims by the month it was debunked, right? So in January, we know that there was a huge spike of community spread type of false claims, falsely alleging that there's COVID-19 positive cases all across the country, from the smallest towns to like the capital city. In January and February, there were about 11 false claims relating to Chinese tourists or China more generally, but this had reduced in the subsequent months, I think, as the international borders were shut. In March, we saw a spike in authority action type of false claim, and I think this coincided with the first iteration of the movement control order, which is the Malaysian version of the COVID-19 lockdowns. In March and April, the scam type of false claims started to appear, taking advantage of the government's assistance plans to provide cash handouts to the needy. If we look at the presumed motivations, right, and the emphasis here has to be made that it's presumed. My colleague and I, we did not interview anyone, so we merely presume what was the motivation behind the creation, and we did this by looking into whether there was a presence of imposter content and the general language that was used. So this is in no way scientific, but perhaps gives some indication of motivations. The largest category of apparent motivation is troll, provoke, or genuine belief. And some people, it's going to be, I'm sure they're going to be puzzled. Why did we lump these two opposite ends of the spectrum of intention together? And I think this highlights that determining intention based on the content alone is quite difficult, and we did not feel confident enough to make an assertion that someone was trolling or provoking when it could have generally been due to genuine belief, right? So for example, there was a claim in January where someone was alleging that if we were to look at the COVID-19 virus under a microscope, it resembles this alien-like creature, right? It's obviously a conspiracy theory because we know that's not true, but at the same time, we can't ascertain whether he was intending to troll or he actually believed in it, right? But what's concerning is that there were 11 instances where the presumed motivation was poor journalism. And I think I say this is concerning because we know that the media needs to be trustworthy during this pandemic. When it comes to imposter content, what needs to be noted is that out of the 353 samples that we coded, a mere 30% or 107 had some element of imposter content in it. The largest type of false claim that contained an element of imposter content was authority action, and the second largest was community spread and also scams. The unsurprising thing for us is that the government was the largest type of authority that was being impersonated for the top three most frequent false claim being made. All right, so that out of the way, so some of the potential implications that we are looking at, right? So we know things like false claims about community spread can create panic. That's a given. False claims about authority action, meanwhile, could create confusion about the appropriate SOPs that needs to be adhered to by the Malaysian public. But besides the more generic stuff, right, we also saw a spike in anti-refugee and anti-migrant workers false information in April. So one of the consequences of this, I think, is that it could have potentially desensitized Malaysians towards what critics deem to be harsh, heavy-handed measures towards these vulnerable groups. So if we do a content analysis of the general types of anti-refugee, anti-migrant worker false information being made in April and I think May, includes things like Rohingyas are insisting on full citizenship rights, they are clashing with the police. I think this was a false video of an incident, I think, happening in Indonesia or the Philippines, and they removed the audio so you can't tell what language they're speaking, but basically it's the what they claim to be the Rohingyas clashing the police, right? There's also false claims that they were receiving monetary allowances from the UNHCR, which was a bit of a which left a bit of a bitter taste in the mouth of some of the Malaysians because, mind you, this was happening at a time where many Malaysians were struggling to make ends meet due to the economic contractions due to COVID-19. What's interesting also is that there was a report from a news outlet that foreigners were throwing urine at members of the army. Right, the report did not single out migrants of any nationality, but I think it generally contributed to the ill feelings towards the other. Besides that, the fourth potential implication is that the scam type of disinformation is remaining, and this is concerning. And also the content of the scam is actually adapting to government policy. So I think the scammers out there are quite innovative, right? So initially, I think in March and April, some of the scams involve people claiming to be agents that can help you process your cash handout applications from the government. What kind of documents do you need? And I think they then steal your personal data. But more recently, after the government announced that they are allowing people to withdraw from their pension funds, we see fake apps on the Google Play Store for the Employees Provident Fund. And at a single glance, it looks almost exactly the same. Okay, coming to the second point about anti-vaccination propaganda. So this is where my research has been leading for the past few months. And let's see, what's this? Oh yeah, right. So the two sides of the coin. On one hand, we know that a large percentage of Malaysians, 82%, are ready to be vaccinated against COVID. So this is based on the YouGov poll conducted. More generally speaking, child immunization rate is about 95% in the country, which is quite high. And anecdotally, science denialism is not that frequent here in Malaysia. So there's no widespread contention about the need to wear face masks or the need to be socially distant during this pandemic. But the other side of the coin is that pockets of vaccine preventable diseases remain in Malaysia up to 2019. If we look at the WHO data presented there, mumps, measles, all those vaccine preventable diseases are still remaining. And also healthcare experts have been warning for years now that the anti-vaccine groups are being more organized, vocal, and influential in Malaysia. But with that being said, right, although there are two sides of the coin, we also must appreciate that the large majority of Malaysians, I believe, have been persuaded of the importance of vaccines, and they will be willing to receive inoculation against COVID-19 when the vaccine becomes available. But at the same time, I think there's also a minority of Malaysians who are opponents to the vaccination program, and I think they are getting more vocal as well. But the thing about the common thread between these two groups is that they are quite unlikely to change their opinions based on literature reviews that's being done elsewhere. But what I want to highlight here is the group in the middle, the one in the yellow circle, who are trying to do the right thing, but they have genuine doubts and questions about perhaps the safety of the new mRNA vaccination, for example. If this group were not to be able to get credible and authoritative information from public healthcare officials or from the government, then they could be looking for alternative information that might be less credible online, right? So there's a real risk of this group being vulnerable towards anti-vaccination propaganda. Based on the pre-COVID literature review, so these are general vaccination and then vaccine hesitancy research that's done before COVID-19 happened earlier this year. We know some of the reasons behind vaccine hesitancy in Malaysia includes things like misconception and concern about the side effects of vaccines, preference for alternative medicines, the halal status of the vaccines, and this is quite a big issue because Malaysia, as we know, is a Muslim majority nation. There's also distrust towards healthcare professionals and the government more generally. But looking at the social media comments about COVID-19 vaccines more specifically, I think four things stand out so far. The first being the long-term consequences of the mRNA vaccines. And I was meeting with a healthcare professional yesterday, and he was explaining to me that even among his medical colleagues, the questions about the safety of the mRNA vaccines is not as certain as we would like. There's also, okay, this is basically a false claim about mRNA vaccines changing a person's DNA. And while we might laugh at it, I mean, some people are going to believe this, right? Halal status of vaccines is remaining, and I think the government is already engaging with the Islamic authorities in Malaysia to come up with a fatwa about it. And of course, there's some conspiracy theories about how Bill Gates wants to insert microchips in everyone, how this vaccine is a measure for population control, etc. Okay, why I've been focusing my research on anti-vaccine propaganda, right? I mean, in the earlier days, the consequences of the false information, they are a bit more limited. But when it comes to anti-vaccine propaganda, there could be like real harm, right? Also, based on what's being said more recently, right, there's only a thin margin between the number of Malaysians that can be vaccinated and those who cannot, right? And the margin here is really important to ensure herd immunity. So according to the Deputy Minister of Science, Technology and Innovation, he said that 30% of Malaysians cannot receive the vaccines because they are either below 18 years old or because they have some sort of disorder in their immune system. So that's 30%. And the plan now for this 30% of Malaysians is for them to be protected through herd immunity. Meanwhile, I think there's no like scientific consensus out there yet, if I'm not mistaken. But from what I've gathered, experts are saying that to achieve herd immunity, you need 60 to 70% of the population being inoculated against COVID-19. Right? So again, the thin majority that highlighting that all Malaysians who can be vaccinated needs to be vaccinated. And there's a real risk if the anti-vaccine propaganda is not being countered adequately, then this could undermine efforts to achieve herd immunity in Malaysia. Also, there's more big picture consequences to this, such as the high economic cost of the pandemic drags on longer than necessary, and of course, goes without saying, life and death to some. The last point that I want to highlight is about the lessons learned in 2020 and what we can do moving forward into 2021. I have a more comprehensive list of this, but generally this is the 4 things I strongly believe in. The first is that measures to deter would-be creators and to prosecute creators of COVID-19 false information runs the risk of being disproportionate. Right? Some of the people who are being alleged to be creating or sharing false information might not genuinely know better. Right? Digital literacy skills in Malaysia is still left wanting, and we need to be cognizant and we really need to appreciate the fact that during this pandemic, people naturally want to share information to their friends, families, loved ones. Point 2, policy communications for the government from moving into the new year really has to be clear and coherent, right? So I'm not sure how it is in other countries, but due to the novelty of the whole situation, there were many backtracks or policy U-turns when it comes to the implementation of the lockdown standard operating procedures. So this had created confusion among the Malaysian public. And when it comes to anti-vaccine or propaganda, what really needs to be addressed is the trust deficit in government. Right? The government should not be responsible to deliver pro-vaccination messages by themselves, right? Because some people just generally don't trust in the government. And I think this is healthy in any democracy around the world. So what really must be done is for the government to include more stakeholders into the whole process of communicating the need for vaccinations in Malaysia. The last point I want to highlight is we know that fact-checking is a need, it's a good thing in itself, but we also must be cognizant of the fact that its reach is going to be limited, especially relative to the viral fake news, right? And also that fact-checking efforts are always going to be hamstrung as a reactive measure. So you have to wait for for fake news to go viral or for you to pick it up before you can fact-check it. So I think this points to the last bullet point there about how we need to be doing more to build society's resilience towards false information. And I think with that, I'm done with my presentation. Thank you.
Hello everyone. Good evening Indonesia time. First of all, thank you for RSIS for having me. I'll be presenting about Mafindo's role on fact-checking and educating COVID-19 awareness during the infodemic. My name is Aribo Sasmito. Call me Ari to make it easier. I am the co-founder and head of the fact-checking committee of Mafindo. Mafindo is an Indonesian anti-hoax community. Indonesia, just like the rest of the world, so we are sharing the common problem here. We are plagued also by the infodemic. Some examples of COVID-19 false information in Indonesia. I'll be presenting about it next. This was in the month of January before the announcement of the confirmed case of patient 1 and patient 2 in March. Among other type of the false information, the common pattern in Indonesia would be the confirmed case of infected in hospital name of a certain city. First example, this was a WhatsApp broadcast using the narrative saying that please inform taxi drivers when picking up passengers from Sarjito Hospital required to wear mask. Confirmed this morning, 2 nurses are infected. Sarjito is a hospital located in Yogyakarta, which is in Central Java and Java Island. Next, this is from a different type of media. This is coming from Instagram stories. The narrative said that for your information, for our precaution, RSWS Hospital in Makassar is treating 1 patient of corona suspect. The patient just returned from Wuhan. Please wear mask. Now the please wear mask part is actually a good suggestion. Unfortunately, this is also false information. The location took place in Sulawesi Island. The city name is Makassar. And the next example, this is from different type of media again. This is coming from Facebook. Unfortunately, this Facebook status is sharing from one of national media that we are suspecting they are using clickbait for drawing readers. The photo is actually about the simulation on handling COVID-19, so it doesn't actually happen because as you see, there are actually people behind the people that wear the protective suits. The narrative said, this actually is the title of the article. Suspect of infected with corona, 1 patient of Dori Silvanus Hospital is isolated. Now the Dori Silvanus Hospital is located in Kalimantan Island. It is actually located in central Kalimantan. So it's basically moving rumors of positive patient in certain cities, in certain hospital. Whenever one fact check clarified, then the next day or even the next hour, it will be moving to another hospital. Other false information examples. The first one would be about the unproven treatments. This is something that's circulated globally because it actually is translated to Indonesian language also. The first one would be mix of salt and warm water can cure coronavirus. You can gargling it before you drink it. And then the second example is about the prevention of coronavirus by drinking warm water. I wish it's that easy. The second type of the false information distributed in Indonesia would be the conspiracy theories. This first one, this is quite, I'm guessing you are quite familiar with it. It's the pandemic video. The second one, also previously presented, also circulating in Malaysia, is about the anti-vaccine, saying that do not accept the vaccine because there's a microchip injected through corona vaccine to remotely kill Muslims. Now, this type of false information is usually largely distributed because Indonesians are known to be religious and family oriented. So whenever we receive something that threatens to people that we care about, because we are family oriented, then we'll right away distribute it. And if it's religious, then we'll easily believe it because it actually trigger our feeling of danger because we belong to a certain type of religion. Last but not least, The third type would be the classic context twisting. This is also appeared previously in Malaysia. The first example, it's actually a picture of art installation in Germany, where it is falsely distributed using the narrative saying that this is the dead bodies of on the street of Wuhan. People easily believe it because picture, photos, and videos are usually easier for people to be accepted because it's visually appealing, more appealing. The second one, a video of a toddler fed with live tadpoles. It actually goes viral in 2018. It is shared again in 2019 with the false conclusion of how to build false conclusion, saying that this is how it started. Even since toddler, Chinese eat uncooked meat. So that's the false premise. That's the false conclusion that the people that trying to distribute in the internet. But also this type of false information is usually to trigger people being racist to the Chinese. And the last example, it actually happened, believe it or not. Some people are taking the video of 2007 serial aired by Hallmark Channel. It is titled Pandemic, and then they reshare it using the false narrative, saying that this is the video of mass grave for Italian corona victims. They actually take it from a scene of a movie. Now, what makes the matter worse of this false information spreading? Some of them would be literacy, the same problem like the Malaysia. Literacy is actually Indonesia's classic problem. Back then in 2019, we were actually ranked second out of 61 nations. So basically we're on 16. One of the effect would be people share what they stumble on online, on social media, on instant messaging platform right away, even by reading it first. So basically they just read the title and then they reshare it by saying, I get this from another group. I get this from a friend of mine. So they don't even read the whole content of what they see online, but they just simply reshare it. Now, the effect of the literacy problem is even trying to educate public about the importance of understanding context, such as even the basic context like the 5W1H is quite challenging, because whenever people see something, a picture or a video which appear to be not edited, it is original, then they would simply believe the narrative without understanding that the false claim is in the narrative. And that is worsened by the negative effect of social media, such as the filter bubbles and the post-truth. Again, this is something that I'm quite sure that everyone is familiar about. Now, this is the most difficult part that we have to deal with, because the false narrative is usually coupled with narrative to trigger people's emotion, especially the anger and fear part. You cannot easily stop angry and frighten people on sending false information, because they actually really believe that what they're sharing is true. Now, this type of false narrative using narrative that trigger people anger and fear is effectively, successfully the perfect formula for misleading people during the infodemic time. And last but not least, this is by the politicization of the pandemic. Generally in Indonesia, at least, it's between the ruling versus the opposition. And although it is true that there are those who's making false claim about, for example, the coronavirus is too hot for Indonesia, the false claim indeed made it worse. But even without the false claim being distributed, politicians are constantly at war, battling with each other, using the pandemic just for the reason. So they're arguing not because for the benefit of the public, but just for the benefit of themselves, And the war between these politicians are amplified by their supporters using social media. Social media is the battleground because it's cheap phones, cheap internet quota, and it is also easily spread. And the next part of my slide, the last part, would be Mavindo's efforts during the pan on infodemic time. Now, Mavindo was back then created basically of how to make the movement to be offline coming from online. But because of the current condition, basically we cannot do many physical activities because of the social distancing, and we call it the large-scale social limitation. So we are forced to doing it online. But again, there are actually a limited amount of our offline education. Mainly, it is for educating the public on several series to raise the awareness about the danger of the COVID-19. Some of the series would be Yogyakarta. A few months ago, we are handing out pamphlets, we are handing out stickers, we are handing out masks and other materials that asking the public basically, please wash your hands and also do not forget to wear masks, whatever it is that you do, especially when you are getting out of the house. The second series among several series that we are doing these offline activities, because currently Mavindo exists in at least 17 cities with 500 volunteers. The second series is the capital city of Indonesia. It is in Jakarta. We are handing out, working together with Indonesian National Police, we are handing out merchandise bag, which contains pamphlets, leaflets, vitamins, also stickers, mask, water, and also hand sanitizer to raise the awareness of people, those who are using the commuter line train in several train stations. And that was the offline activities, which is, again, it is very limited because of the current condition. And the second activities that we're doing during the infodemic is the online, the daily fact-checking activity. So basically, our daily fact-checking is we are doing it online. First of all, during the early days of the infodemic, we are establishing a task force to prioritize and to coordinate our fact-checking activity to make sure that whatever it is that we're doing is prioritizing the COVID-19 fact-checking, and also by compiling the fact-check results article in one article. Currently, it is more than 557. It's quite a lot, actually. This is to make this compilation post is to make it public easier to find fact-check articles about COVID-19. And the fact-check results is published through Mavindo's fact-checking ecosystem. Basically, the work of professional fact-checker team, which is full-timer, and in combination with the crowdsourcing community fact-checker, are stored in the central fact-check database, the termbreakhost.id site, which is open and publicly accessible via HTTP or browsing, or also RSS feed. And also it is accessible via our API engine, which we call it Yudhistira. And we publish our fact-check result using our social media accounts. We are available in Twitter. We are available in Facebook group and also fan page. And also we also have Instagram account. But another way of we publish our fact-check result is also to work with at least two national radio, the KBR radio and the Nation radio, the RRI. We are working together with them on having some kind of talk show. It's aired weekly, publication is weekly. And then last but not least, because this is currently this is the era of everything is using an app. We also currently already have an application available through Play Store of Android and also iOS. We have an application called the Hoaxbuster Tools. And also, we also have a WhatsApp chatbot, which is our latest addition to our fact-checking ecosystem. It's our latest technology. So that would be all. My presentation. It is publicly available on the URL that you're seeing right now. Thank you.
My name is Edward. Here's a photo of me. Here are some of the organizations I'm affiliated with. Bellingcat Investigative Journalism Group. They were first really well known for doing the MH17 investigation, and we also were nominated for an Emmy News Award this year, which was exciting. And also the Princeton, oh no, is my keyboard not working? Oh, great, it is. Okay, and also the Princeton Cognitive Science Lab, which I'm doing my thesis work under the advising of Professor Tom Griffiths, and I'm doing my thesis work on QAnon and looking at the semantics of it through training word embeddings, all of that stuff as well. Great, here's what you're gonna get in this presentation. I'm gonna start by talking about some work I've done related to WHO and health disinformation. And then I want to provide you guys some resources to support your own investigations, resources on collecting data and doing some of the analysis. And then if there's time at the end, I do want to talk about some current work I'm doing related to QAnon, because that stuff is, there's some really exciting stuff there as well. Great, let's start with the WHO case study. So I authored a piece on Bellingcat in August titled WHO Director General Attacked on Twitter with CCP related memes. And Bellingcat tweeted it out and everything. And the people at WHO ended up reading it. Dr. Tedros, the Director General, himself personally read it, and they reached out to ask me to present this to them. So I did once to their senior leadership and another time to their entire staff. And part of this presentation is a modified version of what I did for the WHO, and also it was motivated by conversations with WHO. So I'm going to tell you some of their top questions and key findings in my investigation here. So to start, what was happening? Basically, Dr. Tedros, the Director General, was being spammed with memes. And here are just two examples of memes, but a lot of them were really vile. There were a lot more memes that played on racism against Dr. Tedros as well. And these memes were coming at times in his Twitter feed that were within tens of minutes after he tweeted something. So they were very much, repeated spam. So here are like times of accounts just spamming him. And this was a huge problem because it sort of destroyed the Twitter experience of engaging with Dr. Tedros's Twitter, WHO's Twitter, because around more than like 60% of the feeds you would say were just these memes and spam. And it was a really negative Twitter experience to engage, and you couldn't really engage with those accounts anymore. Here's another diagram of top accounts, spamming that were spamming Dr. Tedros in June on the left and in July on the right. This visualization shows that the network was evolving because actually there's a high turnover rate in the accounts spamming him. A lot of accounts were in June were actually deleted by Twitter or actually removed in July. And here on the right, I tagged some new accounts, which are accounts just recently generated. That's also a sign of possible inauthentic behavior on Twitter. We'll talk about later as well. But here are some of the questions the WHO had. What was the timeline of what's happening? Is there a bigger problem? And how should we respond? First, on the timeline, so the memes and the attacks on Dr. Tedros sort of spiked in June and July. And they died down later in August, both because the WHO's own outreach to Twitter to take down a lot of these accounts. And maybe my piece was published, who knows, maybe that helped as well. But when did this all start? Actually, it was starting in April. And how do we know that? There's a couple ways. First, we could look at some of the hashtags that were, very incorporated in the spam. So, for example, hashtag CCP lied, people died. Hashtag WHO lied, people died. And track when these hashtags first appeared on Twitter. That was around April. Also, we can use technique of reverse image searching the memes. And reverse image search is really popular OSINT technique just to search in engines like Yandex or Google. And a lot of these memes were appearing first in April on the internet as well. And first on Twitter in April as well. Is there a bigger problem? Yes, at the same time, a lot of health officials, not just Dr. Tedros, were facing spam and attacks on their social media platforms, partly because of human frustration, but there was inauthentic behavior, and this was happening to Dr. Fauci with #FireFauci, the chief medical officers of the UK, of Brazil. So there was a bigger problem in the community. And last question, how should we respond? The initial thought that jumped to mind was, don't feed the trolls, don't sort of like engage on Twitter, because they were asking engage there. Also, do outreach to Twitter. Twitter has removed a lot of these accounts. And thirdly, to be able to conduct some of your own data investigations and be able to publish some findings of and acknowledge that this is happening, whether you're publishing on your own platforms or with organizations like Bellingcat or Mafindo, and just be able to acknowledge that this is happening and be able to point people there. That's really a powerful statement, and just do not be passive there. With that being said, I want to be able to tell you some of the resources and techniques that I use to support your own investigations. And here is a list of data collection sources. It's a long list, but I'm going to quickly go through because I think it'll be worth your while. First, to get Twitter data, there's the Twitter API, which is a great place to start with. You can use Tweepy with Python to collect data as well. However, when you're at a number of tweets more than, let's say, 6,000, you're hitting a lot of the Twitter API rate limitations. And I've been in contact with Twitter. After you hit the rate limitations, it's pay to get more Twitter data, and it's really tough. But Twitter is also trying to make API tracks right now, and like tracks for researchers and academics that are cheaper than corporate entities buying their data, but it's still quite pricey there. So another tool are data scraping tools. Twin is an amazing data scraping tool we love to use, and it was really critical to this investigation. During the month of August, it was sort of deactivated for around a month because of Twitter API complications, and that was a very important time right before the US election. So there are some other data scraping tools like SN Scrape as well that you can use, and they're really useful. Then there's a bunch of data analytic companies. TechSifter is a really great one. Then there's a bunch of online applications that you can just like enter a Twitter account or a hashtag and get quick analytics with that can help with your own analytics. Follow.me is a really great place that I like to use to just get some top keywords and like tweeting frequencies. Then there's Twitter search terms and TweetDeck. So this is really powerful in your own search on Twitter. So for example, investigation I did on tracking desert locusts, I can go on Twitter, put in the keyword locust, put in a geocode, and sort of get people tweeting about locusts within those geocode and sort of track where these desert locusts were moving through people tweeting on Twitter. So Twitter search terms are really great to learn. Then there's search operators outside of Twitter as well. So for example, when you're dealing with platforms like Instagram or Facebook that don't really have like an API, something really good is when you're searching on Instagram's own search bar, you might not get the right results that you want because they have their own search algorithms, but instead you can put these search operators into Google, like site instagram.com, in text, no social distancing, and you get a lot of really great results that you won't get by searching the same things on Instagram search. Great. Okay, next, here are some signs of inauthentic behavior. We're looking at things like when these accounts are generated, their tweeting patterns and frequency, if there's a real profile picture, tweets content, if it's the same, Twitter history, if there's a huge amount of time between, let's say, 2016 and 2020 that they stopped tweeting and they're only tweeting during election years, and also networks and connections. Great. Here's an example of a sign of inauthentic behavior of tweeting frequency. This is the tweeting times of one of the top accounts that are spamming Dr. Tedros. You see there's only the longest interval sleep was 2 hours, which is a sign of possible inauthentic behavior. I do want to say that this technique is not transferable to everything because there's a lot of spammers that only tweet at a specific time, but this was a sign of possible inauthentic behavior for the WHO investigation. And as a comparison, I'm just putting Dr. Tedros' sleep time. You do see a solid 7 hours of sleep available here, which is a sign of a potential human account. Okay, the last tool I want to talk about with tracking inauthentic behavior, is looking at networks and if there's a network of inauthentic accounts. This wasn't really important. This is from the WHO investigation to plot out a lot of the top accounts were connected. And that's a sign of this is not just one inauthentic account, there's potentially a network operation. Here's a larger example with Philippines. I have a friend, BBC, Howard Johnson, based in the Philippines, and he was giving me some hashtags to look at. This is Duterte, which is related to Duterte. And if you just, this data was pulled with Twint and visualized with a tool called Gephi, which is really great. But you see a huge cluster in the bottom right of accounts that are only connected to each other. It's almost like a cancerous cell, and that's a sign of possible inauthentic activity that you can look further. Here's the same, there it is. Here's the same technique used with the larger data set of Twitter accounts pulled, a larger hashtag, we win as one, also related to the Philippines. This was related to the SEAC games. And you see the same thing, a cluster of accounts that are only connected, retweeting each other. And that's a sign of possible inauthentic behavior to look further into. Great, we have some time to just talk about QAnon. And I really do want to spend some time talking about this as well. I hope, assuming most of you have all heard of QAnon. If not, there's some great like Washington Post pieces to read up on. Recently, I got a complete data set of all the Q posts to do analysis, semantics, and for my research as well. And I just want to show you, this is the visualization of the top key terms during the first months of QAnon posts, October 2017. You see a lot about Hillary, HRC, Hillary Clinton, Huma, her top aide, things like Control, George Soros, another bad actor in the theory, and sort of the central tenets of the theory forming. Just for fun, here's a comparison of the visualizations in May 2020. A lot has changed. You see terms like COVID, lockdown, time, control, and the top QAnon posts, and the QAnon posts during this time. I showed that to you because I do believe that QAnon is such an evolving theory. It's incorporating other conspiracy theories. It started with, Pizzagate and Hillary Clinton, and it's grown so much through the last 3 years. And it does incorporate a lot of the pandemic conspiracy theories other panelists are talking about related to health disinformation. And here's an example of a QAnon drop from April 8, 2020. You see things like, why did WHO make several strong recommendations not to impose travel ban? You see things about hydroxychloroquine, that they're thinking that this is, actually like a great magical solution. And you do see a lot of health disinformation in Q's actual drops. And this is a problem because then you have these like an army of powerful like bot accounts and inauthentic accounts just retweeting this and posting this information on social media. Here in this example of an account with 5,099 followers on Twitter that's QAnon related. Okay, this is my last slide. And I actually think this is my most exciting slide. Yesterday, one of the panelists in the election disinformation was talking about the Trump war room and how they're mobilizing people to tweet on Twitter. Here is the QAnon war room. I found this on Akun, which is the current platform where Q drops are happening. It went 4chan, 8chan, Akun. And what you see here is almost an instruction book of how to be a Twitter troll. You see things like pick 2 to 3 hashtags. You see things of the times you're recommended to post EST, the hashtags to add, like an instruction guide of how to be a troll. And I want to show you this because it shows, one, how interconnected disinformation our social media are with these conspiracy theories, and how that it's almost platforms like Akun, which are a corner of the internet, are mobilizing to, and definitely generating the content to have disinformation operations in other social media platforms. So definitely this conspiracy theory is connected with all the other health disinformation we talked about. So that is the end of my slides and presentation. Thank you guys so much for listening.
My name is Roman Adamczyk. I'm the head of research for the EU Disinfo Lab. We are an NGO which focus in tackling disinformation in Europe. And what I'm going to present to you today is the evolution of what we have seen in terms of conspiracy theories. So that's a good transition after the last presentation about QAnon. And I'm going to show you what we have seen in Europe, and in particular at the EU Disinfo Lab, we are doing a specific monitoring on 3 countries, which are France, Italy, and Spain. And we are looking at all the fact-checking articles and trying to analyze it to try to see some trends with the infodemic. And one first thing and an important thing to understand why we are seeing so much conspiracy theories being spread in relation to the coronavirus is to understand what is the environment which has been created by this international pandemic and why it is favorable to the spread of conspiracy theories. First, one important thing is really it's really uncertainty. And what we have seen, this criteria is not that present anymore because the pandemic now is something that everyone experiences. But at the beginning, when in Europe, for example, government started to talk about putting in place some lockdown, there were questions about cures, about how much time it's going to take to get rid of the pandemic. This situation of uncertainty was filled by people trying to spread some messages. What is also important is that the pandemic is going to affect everyone. So it's favorable because everyone can be looking for answers. It's favorable to the spread of conspiracy theories. One important factor is also the lack of transparency and sometimes the contradiction that we have seen in Europe in the decisions. For example, we didn't, for now, we didn't have enough time to do very deep studies, but we have seen signs of people using the contradictory measures about masks to try to use this. And then one important thing to understand is also that governments, it's also that conspiracy are based on distrust against authorities, against media. So not all of this is new, and the environment was already favorable in certain communities to the spread of COVID-19 conspiracy theories. What we have seen at the beginning is 3 big types of conspiracy theories about the origin of the virus, so also linked to political and geopolitical concern. We had people trying to blame, to claim that China was responsible for the virus, and that the virus was man-made, and we don't have any proof of that. The other important thing that we have seen, especially in France, it's about conspiracy theories about cures, and now about vaccines. So hydroxychloroquine was especially a big topic in France because one of the main doctor was one of the main promoter in the world of hydroxychloroquine was a French doctor, and then also with what we have seen in the US with Donald Trump promoting this cures, and then which is probably now the most widespread narratives are about secret agenda behind the pandemic, which means that there is something shady going on and the COVID-19 pandemic is not real. And then you have also people in conspiracy theories. One important thing is people looking for targets. So it can be foreign power, like I said, about the origin of the virus, blaming China, blaming some specific countries for the pandemic. It could be some minorities, like elites, the elites, big pharmaceutical companies which are targeted. And it can be, of course, the government, especially with the lockdown measure. It's one of the main targets. And what happened is that at the beginning, we saw really a large diversity of conspiracy theories. But then all these things were consolidated in more specific communities, and for us, these communities were built on 3 pillars. First, what we have seen is that we have seen some public figures endorsing some conspiracy theories about vaccines, about, for example, in the UK, one phenomenon, we saw a lot of attacks against 5G masts after some celebrities pushed conspiracy theories linking COVID-19 and 5G. We had also some politicians spreading conspiracy theories. So these public figures which have big accounts and which have access to media, they contributed a lot to having conspiracy theories being spread. Then what we have seen in Europe, it's really the building rapidly of a conspiratorial community online, especially on Facebook, around very, very big Facebook groups focusing only on COVID. We had also some fringe website built only to talk about COVID. And so here you have a place where people, something well known, echo chambers, where people can feed themselves always with the same messages and this confirmation bias. And then you had also conspiratorial actors, so people who were already spreading conspiracy theories in the past, who came and tried to take advantage of the pandemic to recruit new people to have their message spread. So it's how we have seen the apparition of communities, conspiracy communities in Europe, which means that we don't have people believing in only one conspiracy theories, but all these conspiracy theories are linked, and people are going to spread all of them at the same time. One extremely important thing which happened in Europe, it's a demonstration against COVID-19 measures. And with this demonstration happening in several countries, there was really a consolidation of these communities, and a lot of messages spread to say, yeah, this is a global fighting lockdown. It's not just about our country, it's about the whole world fighting this kind of measures. And so you have really a globalization of narratives. For example, here on the right, you can see Robert Kennedy Jr., which is a very famous anti-vaccines activist. And this guy, for example, with the demonstration, and because he went to a demonstration in Berlin, he has started to become famous even in Europe, and some of these messages get spread even in Europe. And there is really and there is really in these conspiracy theories messages that we have seen before: anti-expertise, anti-elites, anti-governments. And what we have seen also in several countries is extremist group trying to take advantage of these tensions. For example, in Germany, during an anti-lockdown demonstration, the German parliament was attacked by people mostly from far-right groups. On the right, you can see the famous far-right activist in the UK, Tommy Robinson, being arrested during an anti-COVID demonstration. So that is one of the main ways, is that these conspiracy theories are being hijacked by this kind of extremist group to really go in a full fight against authorities, against governments, and all this type of actors. What is also difficult for us in Europe to fight conspiracy theories about COVID-19 is that we have seen really a diversification in terms of platform, which means that now messages are spread really everywhere, and especially because a lot of well-known conspiracy theories are now the main figures for this kind of communities. They are able to drive some traffic away from big platform to say, yeah, you need to go there on Parler, you need to go on Odyssey, which is a growing platform in France, because here you are not going to have any censorship. I also put a bit. I also put YouTube here because at least in Europe there was really a big focus when we talked about disinformation about Twitter and Facebook, and YouTube was about a bit forgotten in this fight. And now what we have seen is that YouTube is also a very important platform for disinformation and conspiracy theories amplification. And also these conspiracy communities, they are starting to build really a full ecosystem to be able to produce a lot, and to do so they are using a lot now everything they can on social on the internet to make money and to get money to be able to produce. Here I put a screenshot of the crowdfunding of a crowdfunding platform where a big French documentary called Hold Up was financed, and as you can see, this conspiracy documentary was able to raise a lot of money, and for now our estimation is that it has been seen at least 4 million times on YouTube. So as you can see, you can have small actors, but using internet to get money to be able to develop really powerful messages and really powerful videos, powerful documentaries to be able to spread their message. So the fight against conspiracy theories can't stay only, when we talk about content moderation, can't focus only on the main platform, because now it's really some ecosystem which are getting bigger and bigger. And finally, I wanted to end with a more positive note, which is that even if the distrust against media in Europe is quite high during the crisis, what we have seen is that a majority of people tried to go first back to big mainstream media to try to understand the crisis, and that the confidence, the trust in media is not as bad as sometimes we think. But to continue, especially for conspiracy theories, because conspiracy theories, they are using a lot the idea of censorship to grow. So it's difficult to counter them with content moderation, because people are going to say we are censor. It means that our conspiracy theories are right. So it's important to have this civil society which is able to spread messages, to fact check information, and also to contribute to the fight against the distrust, which is a fertile ground for the spread of conspiracy theory. And that's all for me. Thank you.